everyone, so today I'm going to be talking to you about dysphagia due to flaccid dysarthria. Let's jump right into the terms to know. Dysphagia is a disorder known by difficulty swallowing. It's a problem with your throat or esophagus, so the food and liquids that are going into your mouth are not going down the correct way. They actually have the potential to go into your airway, and which in turn can go into your lungs, which can cause medical complications such as pneumonia. One cause of this dysphagia can be flaccid dysarthria, which is a muscular weakness. So basically the muscles that we use for speech and swallowing are weaker, their range of motion is limited, and therefore it can affect your swallow. There are causes of flaccid dysarthria. It is due to damage to the brain and spinal nerves. So basically, the neurons that are responsible for sending messages to the muscles to do their job are impaired. So these muscles include muscles for breathing, speaking, using the muscles in our mouths to produce sound, and so forth. So this can be caused by surgical trauma, so during brain surgery or surgery on the throat or chest surgery, head or neck injury, if the person has a stroke, because lack of blood supply is to these neurons that are supposed to tell the muscles to do their jobs. And it also can be caused by a disease such as myasthenia gravis. This is a neurodegenerative muscular disease, so the muscle breaks down over time, and not only is it weak, but as the muscle goes on, its strength actually decreases. So there are signs and symptoms that the person is having trouble swallowing as a result of this muscular weakness. So the first column is the brain nerve that is affected due to the flaccid dysarthria, and the middle column explains how it affects the person's swallowing. So let's take a look at the first one. Cranial nerve 5 is related to the jaw muscle and its movement. So therefore, if the person has trouble with this, they're not going to be able to chew their food well. And this impacts the person's swallowing and increases their risk for the food material and liquid sitting on top of their airway or actually going into their lungs by leaving the food material left in the mouth and throat after the person swallows. So cranial nerve 7 and cranial nerve 9 follow the same trend. The lip muscles and the upper part of the throat, known as the pharynx, they're affected in their own way. So therefore, as we could see, they have their own symptoms and their own reason why the person can be at risk for penetration and aspiration. Same goes for the throat muscles, with the symptoms of the vocal folds being paralyzed, having a weak cough, and so forth, and it affects the person's swallowing during and after, and the tongue, decreased tongue movement, the ability of how far it can move, and so forth, and this can put the person at risk for having material left in the mouth after swallowing. So there are signs and symptoms that we can look for that the material actually didn't go down the right way. So this can be the person has a wet sounding voice, they're swallowing multiple times, they're coughing, their throat clearing, and they feel like the food is getting stuck in their throat. So how can we assess if the person has a dysphagia due to this flaccid dysarthria? One way is to look at the person's medical records. You need to look to see their MRI, head scans, and so forth to see if there is damage to the brain or spinal nerves. Also, a speech pathologist does a swallow check in the person's room, so they look at the muscles in their mouth to see how they're moving, and also they give them food and liquid of different consistencies to see how they're doing with their swallowing and if it actually is going down the correct airway. And that it's not going into the airway. A more objective way to look at this is a modified barium swallow study, which is when the speech pathologist gives the person the same food and liquid of ranging consistencies, but they lace the food and the liquids with barium so that it lights up on the x-ray their throat, and they see how they're doing with their swallowing. They could actually see if the material is going down the right way or going into the airway. Another way is we can listen to the person's voice and how they sound. Someone who has flaccid dysarthria can sound like a lot of air is coming out of their nose. You can't really understand the sounds. They're not really precise. The person sounds breathy. Their range, their pitch doesn't really change, and they usually speak in short phrases. So all of this combined will show that the person has trouble swallowing due to this muscular weakness. And these are some treatment methods, ways we can fix this problem. So basically, we can do lip exercises, which are explained in this column. We could build the strength of their jaw muscle by helping them chew. We can do tongue exercises to increase their strength, and so forth. Again, with the jaw, more tongue exercises, and improve their throat muscles, and so forth. So we could just take a second to look at these. They could do them 10 times each. They do them with a therapist. They could also do them on their own time to increase the muscle and how far the muscle can move over time. And another way they could the speech pathologist changes the diet to make it a safer consistency. The liquids might have to be thicker and the foods might have to be softer so the person doesn't have the material going into their airway. So this is nectar consistency, honey thick, and then they also use thicket to thicken it on their own. And also they could change the person's posture in certain ways to make sure that the food and the liquid is going down the right way. So one way is the head tilt shown here. And head tilt is shown here, and the chin tuck, which is shown here. And these are my references.